Now, what we have done in every global summit is that we begin the day with the presentation of an advocate. This helps orient us to the actual problem that we're addressing. This is not a problem in a test tube. This is a problem that involves real people, real women, real families. I'd like to introduce Dr. Beatrice Wiafe. Dr. Wiafe is a specialist in breast cancer and breast surgery from Ghana, West Africa. She is the founder of the Peace and Love Hospital and has done amazing work in the country of Ghana. Dr. Wiafe.
Good morning. I bring you warm greetings from Ghana. I must first start by thanking the organizers for inviting me to say a little here. I also want to say a very big thank you to Susan Jean Comey. I can't finish without mentioning Dr. Ben Anderson. He has been so instrumental in all that we've been doing since 2004 when he first visited us in Ghana. Thank you, Dr. Anderson. Cancer in Africa is a major problem because it doesn't enjoy any priority at all. When we have to compare cancers with malnutrition, malaria, tuberculosis, HIV, AIDS, and even trauma. So we want to ask, can our efforts be justified in such an environment? Because all the efforts are being geared towards HIV, malaria. You find politicians talking about HIV every day. All the efforts are geared towards eradicating malaria and tuberculosis. But we have a point that all these efforts that are geared towards communicable diseases and diseases that can actually be eradicated will come to an end. The pattern of disease is fast changing, tendency towards Western pattern. And it's only a matter of time before communicable diseases and malnutrition will rank low. But cancers will still be with us and will account for larger population of deaths in the countries. In our country, when we still find advanced diseases, breast cancer in Ghana is surrounded by myths, miseries, and misconceptions. The belief is that breast cancer is caused by the witchcraft. It's not a hospital disease. It's a disease that is incurable. It's a disease that arises as a curse on the family, especially when you talk about people with positive family histories. So it's very difficult to actually encourage people to come to the hospital when they think that they rather have to go to the healing houses, the prayer camps, because it's a spiritual disease. So there's the need for local and international collaboration. I term it as increasing or developing the local capacity. It's very important that the local capacity is strengthened, because the international world will not come and stay and do the work for us. We will have to do it, and we can only do it when we are strengthened to do it. We have some local groups in Ghana, and through the help of Dr. Anderson and his team, Ricardo, Massetti, and all those people who have been so instrumental in helping us move forward, we have the Breast Care International, which was registered in 2002, Reach for Recovery in 2003, Mamo Care, Sister Support Network, Hope Exchange, and other NGOs who do other things, including cancers. So these groups also do some kind of work. When you look at the aims and objectives of these groups, you realize that we have a common goal. So it was very important that we brought our ideas together, trying to forge, together and have a strong group which will send the message across. Because if we have all the gadgets and we still don't educate our people, we still don't tell them that the disease is curable, so come to the hospital for us to cure you, we will still be dealing with late-stage disease. So what we do is create awareness. And the Ghana Breast Cancer Alliance has two wings, the Learning Laboratory wing and the Advocacy and Awareness Creation Group, which comprise of Breast Care International, Reach for Recovery, and Sisters Support Network, and Reach for Recovery. So we do these radio programs, TV programs, lectures, community-based screenings. We realize that when we talk to the people alone, when you gather the women and you talk to them alone, you don't get the impact. They receive the message and they get up and go home. Breast cancer is not painful. And in our society, when there's no pain, there's no trouble. So the woman can stay at home with the disease for months, for years, without going to the hospital because of the fact that there's no pain. So these days, we put them down and we do what we call clinical screening there at the villages, in the churches, wherever we gather the women. We also involve the press a lot, the politicians. Even though we can't rely on the politicians alone, by word of what they will say, they will always say a lot. They will always promise a lot. But if you sit and rely on them, you realize that not much can be done. But you need them, because whatever they say is carried out. So if you have a message and they come on board, the message that you say is also taken out there. And I think it's also very important. Some Ghanaians will recognize this man in the middle, who is our late finance minister. He was so passionate about cancers. And he even took us to his community to go and do screening. We enjoyed fufu. That thing in the black bowl is fufu, the traditional Ghanaian diet. And unfortunately, he was one person who was ready to move our cause ahead, but he also died from cancer at I think 52 years, which was very pathetic.